in the rat.
Thank you. I would like to thank the organizers for inviting me. In fact, they invited Nienke van der Hoge, who's postdoc in my team and did most of the work on methadone in the animal model for pain and neonatal pain. So, let me see. Now, this is a picture of Maastricht. We are about here now, and you can see here the Maas, and you can see the elegant city, and I'm sure you will visit it in the forthcoming days. I'm going to talk about repetitive procedural pain in a rat model, and before starting with a rat model, we want to know if there is a clinical problem. Otherwise, it doesn't make any sense to do this research. At least that's our translational idea, or idea of translational research. So, what are the problems? And here I listed them. Of course, we know pain and neonates is an issue in itself. Yesterday we had a beautiful pre-course on neuroscience and basic neuroscience, and this issue was also addressed during that course, not only the clinical but also the experimental. We discussed that. I won't stay with that today, but do premature born babies have pain? That's a question. And what about the acute effects of repetitive needle prick procedures and pain, and do we treat them adequately? And of course, then second question is the long-term effects. Are there long-term effects, and if they are, what is happening and how do we minimize them, and can we treat them pharmacologically? That's the question for today. Now, if you have this clinical problem, and we collaborate with Erasmus Rotterdam, and where the clinic is, and my lab where the experimental settings are, we developed a animal model. It's about 10 years ago now, and if you think about an animal model versus a human, you take this into consideration, the timing. So if you study a rat of 0 between or the first postnatal week, that mimics the situation in the human of the second and third trimester. And if you have a rat of 7 or 8 weeks old, and that's here, that mimics the adolescence or adolescence in a human. So that is important to know. So, and this is a very complicated slide. That is our model, the model as we use it. So we start from neonate rat, first postnatal week, and then we provide them with needle breaks to mimic the procedural pain as it is in the NICU. Here you see the first postnatal week, and every day we provide 4 needle pricks with an interval of 1 hour, and after that we do assessment, pain behavior assessment. And we do that for 7 days, and then so we monitor that, and then we wait for 8 weeks. We also monitor what happens after stopping this and further development, and then we induce a paw incision, a Brennan model, so a kind of a post-operative animal model, so to mimic the post-operative situation in an adolescent. And then we study the effect of this paw incision on the pain for the next, let's say, 10 days, 11 days. So assessing pain in rats, we use the von Frey filaments, which is a kind of a paw withdrawal threshold. And you can imagine that if a rat has a lower von Frey response, or smaller filaments are needed to induce this paw withdrawal, then we consider that the rat has more pain. That's an issue in itself. So mechanical hypersensitivity, it's the major outcome, whether that is nociception or pain. I won't go into detail that. We discussed that yesterday, and if you have questions, you can come to me afterwards. So we have this model, and here we see the first results, the repetitive needle pricks. So 4 needle pricks a day for 7 days, and here are the first 7 days. This is day 1 or day 0, day 1, 2, 3, 4, 5, 6, and 7. And here are the paw withdrawal thresholds. You see the paw withdrawals 1 hour after the 4 needle pricks, 3 hours after the 4 needle pricks, and 5 hours on the first day we provide them, and so on. And you can see there is a difference starting from 3 days up till the last day when we provide the needle pricks. And here you see the control. This is control levels. You see no needle pricks, and 1, 3, and 5 hours after that. We see larger filaments are needed, so less pain. Whereas if we provide the needle pricks, you see there is an increased sensitivity from day 3, 4, 5, 6, and 7. So there's a difference. So the animals do have pain as we concluded from that. Acute pain. We wait for a couple of weeks, and during these 3 to 8 weeks, or between the 3 and 8 weeks, we see no difference between the two groups. So although there is in the acute phase there is pain, the follow-up shows there is no difference in long-term baseline sensitivity. And then after that we induce this post-operative pain, and that's shown here. If you then induce an incision in the paw, which is here, you see the post-operative pain response in a tactile control rat. You see that this holds on for about 5 days, or 3 to 5 days, and then returns back to normal levels. However, if you provided the needle pricks during the first postnatal week, you see the postnatal or the post-operative response is much more pronounced, and it is extended up till 7 days. We did this experiment many times. The first time was here by Lisbeth Knapen and published in 2013 and so on. The model is now fully established, and we see this repetitively. Always a longer and increased duration of the postoperative mechanical hypersensitivity in these rats due to postnatal needle breaks. Okay, so here are still, I'm back to the clinical problems. Can we treat these animals pharmacologically? We know in the clinic there are trials, or there have been trials on use of morphine, paracetamol, sucrose, and even fentanyl is now being considered. But the results are not very promising. So we do have now this model, and we thought, okay, let's have and understand what is happening in our model, and from that try to make a mechanism-based approach. Okay, so how does the anatomy see? How does it look in an adult rat? And here it's a rather complicated slide, but here are the afferents coming in, the nociceptive afferents here in blue, and they enter here an area which we consider to be the pain gate. And here are the thick of the myelinated non-nociceptive are also innervating this pain gate. And there is one process which is very dominant and very important happening in this pain gate. It's a kind of a sensitization of the contact between a nociceptive afferent and a pain transmission neuron. That's been depicted here. Yeah, this is the afferent, and this is the the pain transmission neuron. And you see here, this afferent is releasing glutamate, and there is a very important receptor involved in this sensitization. I won't go into detail, but that's the NMDA receptor. So this NMDA receptor is pivotal in the central sensitization process. And okay, we thought, okay, when pain develops, central sensitization is such an important process, and NMDA receptor is involved. Okay, morphine has been used. Opioid receptors are known to be involved, but I showed you that the NMDA receptor is also very important. And from that, we thought that methadone would be a nice candidate because it has a dual function. There's not only an agonist function for the opioid receptor, but also an antagonist effect on the NMDA receptor. And we know it's even more complicated. If you provide morphine, then opioid receptor will be affected, agonizing, but that eventually will also result in opening of the NMDA cell, which results in this adaptation. And with methadone, clinically used in many cases to provide this effect, the methadone acts on the NMDA receptor, blocks it. So we have a dual effect, an agonist as well as an antagonist effect. And so from that we thought, okay, it's interesting to test methadone in our model. So what we did is we provided methadone in the animals during the first postnatal week. I showed you the response of the animals, and that's now here in pink or in purple. You see here, this is the needle prick animals. They became more sensitive, I showed you. But here is the control as well as the needle prick with the methadone. And we see the methadone-treated animals did not develop acute pain. So the methadone is rather effective in this stage. So there is a decreased neonatal mechanical sensitivity due to the use of this methadone in this first postnatal week. That's interesting in itself, but not that exciting, I think. Oh, sorry. We also looked at later stages. So in the adult, I showed you the needle pricks did result in an enhanced and a longer duration of the post-operative pain in these animals, in the needle pricked animals. And if we apply the methadone, we see a reduction. So the methadone provided in the early phases did reduce and did affect the duration of the post-operative mechanical hypersensitivity, as we interpret that as pain. So from this, we think methadone is an interesting pharmacological treatment. It seems to be prevent not only the acute but also the long-term hypersensitivity in our rat model, and we are currently discussing with our clinical counterparts if and how we could use methadone in a clinical setting. Okay, that's, I think, an example of translational research as it should be. What is our research agenda now? Of course, we want to understand what is happening with these receptors during the development. Here is the opioid receptor mu1, where methadone as well as morphine are agonists for, and we are now investigating what is happening with this receptor during development, and of course also later on in the adult rats due and related to this needle pricking. And here you see an example of the opioid receptor, which is also present, highly expressed in the dorsal horn, where we have this spinal pain gate. Here is also an example of this staining, and I think we have also kind of a 3D movie where you see the receptors situated on the outside of the cell, and we quantify that. And here are once again the behavioral results, and we looked at the presence of this receptor immunocytochemically. We are now also doing Western blot to have more robust data on the presence of this in this receptor. But this is an indication there is something happening due to this neonatal needle pricking with this receptor. Here we see the response is completely different in the postnatal or in the post-operative rat as compared to an untreated or non-needle pricked animal. In addition, of course, we are interested in the NMDA receptor. The NMDA receptor is a rather complicated molecule. It has 4 subunits, and we did a review, or we presently are performing a review about the presence of the various subunits, and especially these 2 subunits, the 2A and the 2B, are related to the nociceptive pathway. And so we think that in the future targeting these subunits might even be more effective and might result in less side effects. Methadone is just targeting the NMDA receptor in general, as ketamine does. It is providing kind of a block, as the magnesium block. Maybe you know the magnesium block removes out, and then NMDA channel is open, and ketamine goes into the NMDA of methadone is a bit the same, but with selective targeting subunits, that might be an important venue to investigate in the future. We are summarizing the literature. We are providing, where we are doing some stainings, immunocytochemically, Western blotting, and this is an example of an antibody staining with the 2A and the 2B, and you see this staining is also located in the dorsal horn of the spinal cord, so again related to the nociceptive pathway. Okay, that is the future, how to proceed, and our agenda. And this is the collaboration between Rotterdam, people are mentioned here, and especially acknowledge Nienke van der Hoge, postdoc. She's now in Canada, and so I'm replacing her and presenting her work. And this is the rest of the team involved. This is Nienke van der Hoge, by the way. So I would like to thank you and open for questions.